Hi, it's Dr. Greg Jantz. As a counselor, now 40 plus years, and founder of the Center Place of Hope, I just want to mention OCD, Obsessive-Compulsive Disorder, and how really stressful life events can trigger. Sometimes a life transition, like significant loss, can be a trigger point to start all the symptoms of OCD. What is OCD? It is classified as a mental health disorder characterized by intrusive, unwanted thoughts that cause you to want to engage in a behavior. Like one we think about is I got to keep checking the lock, making sure the door is locked. So obsessive thoughts, so those are the repeated ruminations in our mind, followed by some sort of behavior in order to try to relieve that anxiety. And stress, by the way, stress affects it doesn't cause OCD, but it can be a major trigger and can accelerate some of those symptoms. High stress does increase anxiety, and it's higher the anxiety, the more we fall into this obsessive compulsive thought and then behavior. Now, life transitions, a move, a loss of job, a sudden accident, a sudden loss, a loss of a loved one, these all can be what we call transitional trigger points. And so a major life transition can kind of bring up some of those repetitive thoughts. And sometimes it seems a little, okay, what's going on with me? And you're noticing this. It's not really terribly unusual, but it can bring that up. And then as you have to reestablish new routines, this is where the ritualistic behavior can kind of step in. I'm on a new routine and it's difficult. All right, trauma and emotional distress, losing a loved one, going through some breakup, but where there's significant trauma, abuse would be one. A medical diagnosis that could be frightening, like a cancer diagnosis, that could be one. Which brings us to the next one, which is these health-related stress points. An injury that could have happened or the medical diagnosis, but it can trigger these obsessive worries. And then I'm just thinking about it. So then I want to do something about it. That's the behavior. And maybe like a medical diagnosis that seems scary, I could be searching and online and doing all kinds of things, hours after hours of online searching to try to find an answer or answers, and then I end up with more anxiety. All right, there are societal stressors that can trigger OCD. Sudden economic turn down, something that feels like political instability. These all could be potential triggers for OCD. All right, we need to keep building. What do? We keep building our health, our immune system at all times. This is so important. We've got to really refine our self-care, which includes exercise and sleep. And nutrition. I smile, but that's important. And drinking our water is important. Having your water on your body or nearby where you're drinking it. All right. We can challenge these obsessive compulsive thoughts. There's several strategies for this. There's some good resources. We've got a couple counselors here at the Center Place of Hope who specialize in OCD, and they do some, one of the things they do is help a person challenge the thoughts, challenge the behaviors. And some of this is taught through cognitive behavioral therapy, which is a whole system of helping us change our thinking. All right, routine's super important. That's super important with the self-care. Just daily routines, which include sleep, eating breakfast in the morning, and doing the routines can really help with the OCD symptoms. All right, there are times we've got to seek professional help and professional intervention. It's just sometimes we wait too long and then we regret it. That's one of the things I hear from folks that come here to the Center, a Place of Hope. I go, I should have done this so much longer ago. And if it is affecting the quality of your daily life, it's time to do something about it. Just find out what the options are. aplaceofhope.com. taking a step and starting to build a plan can also begin to build some relief, just knowing there's a plan.